So we're back live here with Matt. We're about to do the growth factor injection. First, what we're doing is we're taking an ultrasound picture to take a look at the perineals. We have the perineus brevis and longus. The perineus longus is on the outside, and there's a little bit more damage on the perineus longus. The brevis looks a little bit more intact. It's shinier. It's got these spaghetti-like strands is what we want to see. So we'll be injecting mainly into the longus, the outer perineal tendon, but then we'll probably also infiltrate a little bit into the perineus brevis, the inner one. So I'm going to just freeze that, and now I'm going to mark the area. Get this gel off. And I'm going to use a little palpation. We did just have our image. Now I'm going to just palpate here. Is that about where the worst pain is, would you say? Right.
It is.
Yeah. So I'm going to mark it here. X marks the spot. We'll infiltrate a little bit around. And then we're going to just prep the area. Some people like to guide at the same time. I prefer to have the dexterity, if I don't have a third hand, pre-mark it, know where I'm going. This structure is very superficial, and then just go to the entry point. X marks the spot, we're going in. I'm going to distribute evenly. I'm going to go up a little bit. I'm going to make sure we get the some of the lower segment now, so I'm going to reverse track here and go in the other direction. And Matt is not a squeamish individual. Most people are pretty good with this. This is a 25 gauge needle. Some people like a 23. I go a little lower. I don't think going to a larger bore adds that much advantage because we're still getting the growth factors in. We're not so concerned about stem cells here because the stem cells, any that would be residual, would be deactivated by the body. What we're really trying to accomplish here is to get the growth factors to signal our own body to repair the, in this case, the injured perineal tissue. So now Matt will have about a 2-week run to see what the initial effects are. We expect more full results at about 3 months. During that interim, we may interval a little EPAT. We had already intervaled a little bit of shockwave as a pre-treatment just to make the tissue more acceptable to take the growth factor injection. And so we'll be probably following up with a follow-up video of Matt so he can let us know for himself what he feels the progression is.